Well, it is 12 o'clock on the nose, so we are going to get started. I actually just received a text message that one of our panelists is stuck on the Senate floor voting right now. So Senator Hertel may be delayed or may not be able to join us. This is the beauty of live television, folks. Welcome to the Michigan Moves webinar. My name is Michael Stack. I'm the chair of the Michigan Moves Coalition. The Michigan Moves Coalition is a collaboration of all the primary physical activity stakeholder groups in the state. We came together last year to say we all need to speak as one unified voice around the importance of physical activity rather than speaking as a bunch of fragmented sectors. Today's conversation is going to be around movement as mental health medicine. And we certainly know the issues that exist right now with mental health in our country. And, I find it very interesting that May is not only National Physical Activity Month, but it's also National Mental Health Awareness Month. So somehow, some way, chronologically on the calendar, these things both coincide. And we know through a tremendous amount of research that physical activity and exercise, can be as effective, if not more effective than some, common mental health treatments that exist out there. And so this is a conversation today around how we bridge the gap between what's happening from a physical activity and a movement perspective, and we start to incorporate it into how we improve the mental health of our population. So I'm very excited to have a couple of esteemed guests from the University of Michigan here with us today. So we'll take a moment to have both of them introduce themselves briefly. Dr. Deldon, why don't you go first?
Sure. I'm Dr. Patricia Deldon. I'm a professor in the departments of psychology and psychiatry, and I have expertise in mental health and from a both biological as well as a treatment perspective.
Awesome. Dr. Hassan?
And I am Rebecca Hassan. Thank you for having me. I am an associate professor in the School of Kinesiology in the program of movement science. And for the last 10 years or so, we've been trying to understand what are these social factors that influence children's health. And over the last 5 years, we've been working to reduce some of those disparities that we see through promoting physical activity, both in the classroom and at home, to promote wellness, health, and achievement.
Awesome. Thank you. And we're going to talk about a lot of the research that both of you have been involved in, some of the programs that you're involved in. And I love the fact that we're able to bring in people from both ends of the spectrum here. We have somebody decidedly on the psychology end of the spectrum and decidedly on the movement end of the spectrum, but both to speak to the same topic. Before we dive into our conversation, just want to kind of do a little bit of housekeeping for starters here. So this is a webinar. That means you could see us and hear us, but we cannot see you or hear you. So to that end, as I said prior to getting started, I hope many of you are taking a walk right now to take advantage of the beautiful weather. If you do have a question that you would like to ask, please use the Q&A feature. I will be moderating the Q&A feature during the webinar. If it seems appropriate to address that question at that point, I'll pose it to our panelists. If not, we'll hold it towards the end. We will have the opportunity at the end of the webinar to ask questions, so there will be a dedicated Q&A segment as well. But if you do have questions and you would like to ask them, please put it right in the Q&A. We will also be sending out a recording of this webinar afterwards that you'll receive. So be on the lookout for that in your email inbox. We'll probably send that out later today or early tomorrow. So with that said, I want to get into this discussion. As I mentioned earlier, we got some late breaking news that Senator Hertel was not going to be able to join us today because he is on the floor of the Senate voting right now. So he's doing very important political things. So we will have the scientists pick up the baton from Senator Hertel. So let's start this discussion, and I'm going to start with you, Dr. Deldon, because I think we just need to level set for starters. We've all heard that our mental health collectively as a society is struggling right now, but can you help us understand kind of where things are at just based on the statistics and kind of the epidemiology of all this?
Sure. Prior to the epidemic, even, I talked about how there was a mental health care crisis and another epidemic, the mental health care epidemic. We used to think 50% or so of people had a mental illness, but recent research shows that it's actually closer to 86% if you look over the course of their lifetime. Through the pandemic, this has gotten worse. It's increased sharply. It usually in any given moment, 1 in 10 persons would have had a mental illness. Now that is 3 in 10.
Mm.
And this seems to be much worse for each successive generation. So the younger you are, the more difficulty you seem to be having. We used to think this is a older middle class disease for older people, middle-aged people, but now we know it starts in early ages.
Yeah, it is, and you hear more and more. It seems every week that goes by, there's another study that comes out, and there's another conversation around our youth mental health and the role that social media plays. It's almost it's almost too much to handle sometimes, but I think we're here to talk about solutions to that. Ashley, thank you for joining us. We always understand how busy our government employees are. So why don't you take a moment to introduce yourself as you've popped on?
Yeah, my name is Ashley Bradshaw. I'm with the Michigan Department of Health and Human Services. I'm a public health consultant, but within the department, my main focus is on physical activity. And so everything, outdoor recreation, movability, walkability. And so that is my primary focus within the department.
Awesome. Thank you for joining us. And thank you to
Yeah.
Linda Scarpetta, who's the director of chronic disease for MDHHS, for recommending you be on the webinar. We're very happy to have somebody from DHHS being a part of this conversation. So
Yeah, we're happy to be here. So thanks.
So Rebecca, I'm going to put you on the spot right away here. Ashley, I'm going to put you on the spot right away here. How does MDHHS view mental health in terms of its overall public health priorities right now?
Yeah, so within MDHHS, mental health is a public health priority for us. And so we currently just wrapped up a 4-year strategic plan. And so that plan is going to span from 2023 through 2027. And so this plan really reflects our key strategies and public health investments. And so part of this strategic plan is like strengthening the resources that are available to our physical, mental, and behavioral health workforce within the department. And so to really help maintain strong support and optimum services that we can offer not only to our colleagues, but to our internal and external partners that we're working with. And so that is kind of like an inside way that we're focusing on mental health, but that really trickles into all of the services, projects, and programs that we offer throughout the state. I mean, I could give loads of examples, but a couple of them are, for example, our work related to food insecurity. So food insecurity is associated with a higher risk of anxiety and depression. And so our work around improving food access is much more than just nutrition and improving our local economy. It's really about, and at its core, alleviating those negative mental health impacts that food insecurity has for our communities throughout Michigan. And additionally, in my last example is our work around adverse childhood experiences. So we have a project going on that focuses on ACEs, and they're really trying to bring awareness around ACEs and trauma and how it affects our work internally and the way that we deliver it, but also how it affects like the communities that we serve. So they've rolled out a trauma-informed roadmap, and the team is really working around that to provide training, resources, and coaching needed that to help improve the way that we provide our services and our programmers and our programs to Michiganders throughout the state. And so those are really just like a few of examples of how a lot of our work is focused on larger like chronic disease areas, cancer, tobacco cessation, things like that. But at their core, they're really working to mitigate and help improve the mental health of residents and communities throughout Michigan.
Yeah, thank you. I'm so glad you mentioned nutrition, because I mean, we're two sides of the same coin here, right? I mean,
Right.
Physical activity and nutrition. If you're not well nourished, it's going to be very, very hard to be physically active. And you mentioned the adverse childhood events, and I always think of physical activity and sport and those type of things that youth can engage in as the exact opposite of that when they're done in the right environment with the right coaching and with the right resources. And I think, Dr. Hassan, this it speaks perfectly to some of the work that you've been doing with your impact at school and your impact at home program. So why don't you touch on that broadly just to provide some context for those programs, and then you could talk a little bit of maybe what you've observed from the mental health perspective.
Sure. So thank you again for having us as a part of this conversation. And I want to follow up with what Patricia was talking about earlier, talking about how we see mental health being a larger issue in our pediatric populations. And part of that may be because of the fewer coping strategies that children have to deal with some of these global pandemic stressors that they experienced over the last few years. So we paid a lot of attention to, wearing masks, getting vaccinated, but there were many unintended consequences on our children that went a bit overlooked until the data started coming out. We know that globally, as it relates to anxiety and depression symptoms, that 1 in 4 children during the pandemic were experiencing symptoms of anxiety. 1 in 5 children were experiencing symptoms of depression, and that really has not changed much in the few years now that we are, quote unquote, post-pandemic or emerging out of that we still have very high rates of mental health problems, mental health issues, both in the home and in the classroom. And if you think, again, for our really young children, that they missed or they had school online for the first few years. So our kindergartners or our first graders, the first time they're entering into the classroom may have been in the 2nd grade. And so thinking about the levels of social isolation that were experienced, some of these, we can think of them as acute or short-term stressors because they were time limited. But if you experience them over time, they can become chronic stressors and turn into things like loneliness, having lack of social connection, the lack of physical activity. We saw that physical activity declined by 17 fewer minutes. Kids were engaging in 17 fewer minutes. We saw weight status increase by 9%. During that time. So there were just a lot of unintended consequences outside of COVID that contributed to the mental health crisis, an exacerbation of the mental health crises that our children, parents, elderly were experiencing. So what did we do to try to combat that? This is the Nike swoosh of this kind of conversation, is that we didn't want to just focus on the problem. Many of us came together to form solutions. Mike, you were a part of that solution. And when the vice president at the time of the State Board of Education called us, she wanted us to help get kids moving, because for the majority of kids across the state, most of the physical activity opportunities are in schools. So if you think about physical education, recess, physical activity in the classroom, before, after, even sports, they're connected to schools. And so when we had to abide by the restrictions and schools were closed, many of our physical activity opportunities were taken away. For children who live in safe environments and can go outside and play in their communities, it wasn't as big of a deal. But for many of our kids that did not have opportunities in their neighborhood, we needed to create a new opportunity that was not schools, that was not community, but in their homes. And so that's where a team of us came together and created Interrupting Prolonged Sitting with Activity in the Home. And we were able to partner with the Michigan Department of Education, MISHCA, which is the Michigan School Health Coordinators Association, Detroit Public Television, with Applied Fitness Solutions, so the fitness industry, and be able to create activity videos. So our PE teachers across the state came together, created PE videos that we could actually broadcast on public television, so that it was accessible to all families to be able to, you don't need a playground, you don't need space in the schools or anywhere else. You can do it in the comfort of your own home. You don't even need cable or internet, but you can have access to health enhancing physical activity created by our courageous physical education teachers who took the time during the pandemic to create these videos. This stemmed from the work that we had been doing in classrooms. So we have been working with teachers across the state for the last 5 years to promote physical activity in that space, because we recognize that not all schools have recess every single day. Not all schools have PE every single day. Not all schools have safe routes to school. So providing more opportunities for children to be physically active at school and at home, particularly during the pandemic, it's created this great synergy to, again, promote physical activity, not just in the month of May, but across the entire academic and summer months.
Yeah, thank you, Dr. Hassan. I do think it's so important to understand that while certain things had to be done during the pandemic to ensure that everyone was safe, there are always, unintended consequences, and I certainly exacerbated the kind of general trajectory of inactivity in our youth. And the exciting thing about your program that I've always loved is it meets people where they're at. I think a lot of this conversation is, not about you need to go to a gym and exercise and hop on the treadmill. It's, you can exercise, you can move wherever you're at. And I think that your program did a great job of providing that as a resource. And also, it's just great to have the perspective of the adult population and the youth population with Dr. Delden and yourself. And so, Dr. Delden, you, in your academic work and your development of the Mood Lifter program, you acknowledge the role of physical activity and exercise and how it plays a role in improving mental health. From your perspective, how do you look at this?
Well, what we did when we created Mood Lifters was look for the very best things out there that could help people to feel better across a wide range of illnesses, mental illnesses. And one of those things was exercise. So why did we choose exercise? Study after study after study, meta-analysis after meta-analysis shows that physical activity is highly beneficial for improving the symptoms of depression, anxiety, and distress. In fact, if we could get those people who aren't moving at all to move even a little bit, half as much as what's recommended, it's predicted that we could prevent 11% of the onset of depression. Now, if you get people to do half the recommended amount, we know that there's an 18% decrease in depression. And if you get them to do what is actually required, and this is just brisk walking, this isn't anything fancy like running marathons or going to the gym. Like you said, it can meet people where they're at. But if they do what's required, we have a 25% reduction in depression. And as you stated, when we open this up, is that, in fact, some studies find that its efficacy is equal to that of antidepressants. And in my opinion, if it's done safely and according to a doctor's recommendation, has only positive long-term side effects. So for us, it was a no-brainer to include exercise in terms of helping a general mental wellness improve across the population.
Yeah, thank you for that. And to be clear, when we talk about the recommendations, from the CDC, this is 150 minutes per week of moderate to vigorous intensity physical activity. I'm sure many of us that are on this webinar have heard that terminology before, but something you brought up that was so important, Dr. Delden. I think people hear that 150 minutes. And for those of us who are physically active, we might get that in. And, if you're a marathon runner, you might get that in on a Saturday morning. But for other people that aren't active, that seems like a big lift. And, what you said is, we just got to get people going, even half that, and I would actually argue, and I would be surprised if anyone disagreed with this, the most important 15 minutes we can encourage people to be active every week is going from 0 minutes to 15 minutes, not going from 135 to 150.
Exactly. And that's what the research supports, right? It's so your biggest bang for your buck in terms of mental health, the research shows, is getting inactive people active. So, and again, if you scare them with really intense marathon running, so in our program, for example, we talk about exercise and we meet people where they're at. So if say I'm depressed in bed, don't even get up to shower, if you tell me I need to run or exercise 30 minutes a day, I'll look at you like you have two heads, right? But if you are training for a marathon, I say, oh, you have to run 30 minutes a day, you'll also look at me like I have two heads. So what we do for that person who's training already, we're like, keep going, doing what you're doing. That's great. But those people who are not getting out of bed, we say, okay, this week, what we want you to do is get up and take a shower every day. And if you do that, we'll count that as credit towards working towards your mental health. Next week, though, we want you to walk to your mailbox. The following week, down to the stop sign. So again, at the end of the block. So again, we have to not overwhelm people, because again, that's pretty scary for people who aren't moving at all. And again, remind them that just getting going, just getting walking. And if you can do it with a friend and outside, good for you. It has all kinds of extra benefits as well.
Yeah, absolutely. Actually, from a public health perspective, as someone that works for MDHHS and is in the public health space, how do you view physical activity and exercise and its role in improving mental health?
Yeah, so in the field of public health, physical activity has always been a priority, right? In decreasing chronic disease, throughout our nation, throughout our states. But there has been a huge shift, I would say, as of recently, and also, in the amount of research, but in understanding that this also positively impacts people's not only physical health, but their mental health as well. And just like Patricia was saying, there's like a vast amount of research on, the positive benefits and emotional well-being it has on our health. And so we've always been implementing physical activity as one of our strategies, and it's always been key. But what we've been seeing is a huge shift right now. And what I've really enjoyed, in a lot of my work, and, when I was introducing myself, I was talking about outdoor recreation and movability, is the shift that we're seeing in physical activity. And again, similar to what Patricia was saying, is like being away from this like prescriptive idea that we're going out for runs or we're going to the gym, and shifting to this mindset of like, we're going outside and we're connecting with our communities and our parks and our green spaces and with nature. I was actually just reading an article from the National Recreation and Parks Association, and it was talking about the host of benefits that not only being outside in nature has, but being physically active in nature has. And so really starting to think about the way we promote and the way we think about physical activity a little bit differently, to really encompass all these activities that we could be doing. Throughout that article I was just referring to, it was talking about how access to parks and green spaces correlates in a reduction in stress and symptoms of depression, and it just overall impacts your mood and your attention span, and how parks can really help you in a way, in sense of like mental health, connect with your communities and really just find something that I feel like you feel like is a part of. And so it's kind of like a threefold approach, right? We're getting those physical benefits of physical activity. We're connecting with our neighbors, with our communities, but then we're also getting outside in nature. So when we're talking about that like mental health boost, I've really enjoyed seeing that shift of like moving away from like these walking programs and this prescriptive idea of 150 minutes to now being like, let's get outside and find something we enjoy and is sustainable. And that is really how we're going to help improve mental health for our residents.
Mike, can I add something to that?
Absolutely.
So actually, I was involved with one of the first studies in walking in nature, along with colleagues John Janides and Mark Berman in the University of Michigan Department of Psychology. Mark Berman was the lead author on that. And what we found is one of the earliest studies, if not the earliest, I'm not sure, that again, you're right. We had people walk around Ann Arbor, and then we had people walk around in Ann Arbor Botanical Garden, ARB instead. So we walked around the city or walked around and we randomly assigned them. And then we looked at their mood and their memory, and both were improved in people who had walked in nature instead of city. So I really agree with what you're saying. It's not just walking anywhere. If it's more pleasurable and enjoyable, it's going to have all kinds of downstream benefits as well.
Yeah. So what they're talking about, there are like the three different mechanisms or pathways by which physical activity can improve mental health. There's one that's the physiological pathway of just getting up and moving. Then there's the second one where we're talking about moving with other people. So that's the social pathway, because we do know that social support that you can get with exercising with other individuals has a lot of mental health benefits. And then that middle pathway that we're talking about is that psychological being out in nature. There is a lot of research to show exercising indoors or on a treadmill versus in nature, that there is a doubling effect or benefit, mental health benefit, if you're exercising out in nature. So again, we're plugging, if you all are inside right now, feel free to take this webinar outside, because it's a beautiful day out and you'll feel twice as good if you exercise outdoors in this wonderful Michigan weather that we're having today.
Yeah, and I think, ladies, it's such a great point because I think there's been long this narrative around exercise that it occurs in the four walls of a gym and it's on a treadmill or whatever it might be. And yes, that is what exercise is for some people, and there's nothing wrong with that. I've made a career, in that space, but we know based upon statistics, only about 15 to 20% of the American public actually engages with the commercial fitness industry. So there's a lot of people out there that have a very different definition of what movement is and what movement could look like. And I think that that's one of the reasons that this coalition that we've started here in Michigan with all the physical activity stakeholder groups is so important, because yes, we have the Michigan Fitness Club Association, but we have MParks, the Parks and Rec organization. We have SHAPE, the Society of Health and Physical Educators. We have the physical therapists, and we have Trinity Health, and a bunch of groups under this umbrella to say, everyone has a different vehicle through which they want to move their body in a meaningful way, in a meaningful environment. And we can only do that if we're all working together. Rebecca, I want to go back to you on what you've seen in particular with your groups, because again, the mental health crisis in our youth has seemed to taken on an outsized portion of the conversation, but for good reason. What have you noticed, either anecdotally or through your research, in terms of the mental health impacts in the youth?
Of our current situation, or the benefits that physical activity has on the mental health of our youth?
You could take it either way you want.
Okay, I will take it the second route because I always love being the positive Polly on the calls. But thinking about what we have seen. So again, back in 2012, when we're thinking about child health, a lot of attention was on childhood obesity, weight status of children. It was the Let's Move Michelle Obama conversations. And then around 2016, that conversation shifted more to academic achievement. And then now, during and aftermath of the pandemic, it is 100% transition to classroom management, student behavior. That our teachers, our principals, our superintendents, if you talk to them or ask them what is the number one issue that they have been dealing with over the last few years, it has been that classroom management and emotion dysregulation that they have seen in their students. Part because of the pandemic, but also part to just compound all of the different stressors that kids are under to begin with. And so using physical activity has been amazing for teachers and for students. We have a lot of schools across the state that are asking us how do we incorporate more physical activity, because our teachers know that the kids do need to move. They need to have a productive way of getting the wiggles out. A productive way of channeling all of that energy that they have. And they're starting to connect physical activity with a lot of their social emotional curriculum that they're using. For instance, in Saginaw Intermediate School District, Birch Run uses the curriculum zones of regulation. So students will identify what emotion they're feeling based on different colors. And you can imagine that the teacher wants the kid to be in the green zone, which is more focused, calm, attentive, while they are engaged in seated instruction. But depending on what's going on throughout the day, you can have a child in the red zone that they're really upset because something happened. They're high energy, they're in the yellow zone, or they may be sad. And as they did some of these different monitoring throughout the pandemic, many of the kids during the pandemic were in that blue zone. And so we have been working to how do we create different physical activities to help shift kids from the blue zone to the green zone, and helping children understand how do they feel in the moment, and how does exercise help them feel and help them regulate, manage their emotions. And when we have surveyed teachers, they've had a lot of positive results. So when we surveyed our teachers, 95% of them said that just by doing these small bursts of activities throughout the day, they were able to see improvements in focus, attention, engagement in the classroom. We also had 82% of teachers said that they observed improvements in student self-regulation, student awareness, students raising their hands saying, I'm feeling a little out of sorts. I think I need an activity break. And so asking for those breaks and then finding positive ways to manage their emotions and behaviors. We've seen 68% of teachers surveyed said they saw improvements in test scores, and 86% said they saw improvements in mood, saw improvements in positive activities or positive energy, excitement around movement. Kids like to move. Like, you were usually telling kids, please sit down, but now for the first time, teachers are excited to be able to say, no, get up in a structured fashion. Let's prime the brain for learning. Let's reset that brain, reset it for learning, reset it in terms of our emotions. And so we have really had a lot of success in supporting our teachers, supporting our principals, and promoting more physical activity in the classroom. If I can have one more minute, we're also continuing to do that in the home environment. So during the pandemic, we recognized that parents were getting a lot of time with their children as we were sheltering in place. So a group of us came together from the Michigan Department of Education, consultants with Mishka, health coordinators, school psychologists, and teachers to create the family engagement or family empowerment toolkit that connects. Parents can actually work together through the toolkit, through these modules, to see, how does physical activity connect with resilience? How does physical activity connect with feeling good? What are those chemicals that are released when we actually exercise that make you feel good? How do we make health choices? How do we even get started with exercise? How do we engage in exercise snacks throughout the day? How do we create plans and schedules to promote more physical activity to improve our mental and physical health? And all of those toolkits are freely available on our website to, again, not just move, but also provide more educational and support resources to both our teachers and our parents to help us move together, think together, and be together. And so we're continuing to promote and push out these resources, and we're working with our regional school health coordinators to make sure that everyone feels supported to promote movement for mental health.
Awesome. And we will link up when we send out the email after the webinar with the recording to your website, so people have access to those resources. Two comments I want to make before we kind of bring this to some actionable steps for our audience. The one comment that really strikes me, Rebecca, is that we're not talking about gym class here. This isn't like what you do in that 30 minutes twice a week that you're in gym. To be clear, you're talking about activities in every classroom, no matter what the subject. And I think that's so powerful, because we know that in most schools, unfortunately, we've kind of engineered physical education out of the curriculum. So this is, how do you build it into your day, which I think is, so critical.
Yes, and I think it's important to say this is not a replacement for physical education. Physical education is the cornerstone for teaching children the motor skills that are necessary for engaging in physical activity. And we still need to be promoting, pushing, encouraging, funding physical education, daily physical education, because the research shows that we can get kids 23 minutes of physical activity every day if we have quality PE in every schools. This is to create a buffet option. So we don't want to just hang our hats on one thing. We really are trying to create a buffet of different options, both inside school and outside school, so that kids can engage in exercise snacks all throughout the day. You love that nutrition reference, Ashley? So that's how we focus on nutrition, is by thinking about what are all the different opportunities that children, adults, anyone can engage in physical activity, and then how do we accumulate it throughout the day? So even as we were talking about 15-minute bursts, you can accumulate it in as small as 2 minutes. And I do 2 minutes throughout the day. And those are just as successful as if you did it in a 15-minute chunk when you're talking about health and well-being. So let's give every kid an opportunity to engage in a buffet of options to eat their exercise snacks.
Absolutely, yes. And that was the big change from the 2008 physical activity guidelines to the 2018 guidelines, is that everything counted. The other thing that it just strikes me, and Dr. Tony Moreno is on the webinar. I see he posed a question we'll get to at the end, and Tony and I often talk about the concept of physical literacy, the ability to be confident, competent, and actually have the capability to do physical activity. And just like if a child was not literate from a reading standpoint, or they had poor numeracy and couldn't do math, we would consider that an American tragedy when kids graduate high school and they didn't have those abilities. But yet the very same thing is happening from a physical literacy perspective. And so, Rebecca, to your point, the ability to allow kids this buffet to be able to move during the day allows them to be able to develop the physical literacy in childhood to become physically literate adults. So, if they are dealing with a mental health issue when they're in their 20s and their 30s, and Dr. Delden, our colleague, recommends going and doing some physical activity, to actually have the confidence and the competence to be able to do that. And so I think it's so important to, as they often say, start them young. I want to, in the time that we have left, I want to get to actionable steps, because ultimately at the end of the day, we don't, and again, Dr. Moreno, who's on here, I'm going to steal a quote from you. We don't need any more white papers. We have enough white papers on this topic. We know that physical activity and exercise and movement is important. It is a nonpartisan issue. It's one thing that everyone can universally agree on. We should all be moving. So from everyone's different perspective, and Dr. Delden, we're going to start with you, and you could speak to the mental health professionals that are listening. What would you recommend for those professionals as action items coming out of this to consider with regard to physical activity and mental health?
Yeah, in general, I view mental illness as having biological, psychological, and social causes and consequences, and therefore our treatment should be the same. So, and we usually only focus on one, say cognitive therapy, or if you go to a doctor, medicine. But I really believe in taking a broad approach, a buffet approach to mental wellness across 5 different domains: thoughts, feelings, relationships, behaviors, and activity, biological. And so my recommendation to therapists who are listening is that physical health, physical activity, sleep and exercise, diet should be a mainstay approach to the management of all psychiatric conditions: depression, anxiety, psychological distress. So I recommend starting where someone's at and encouraging them to start exercising, because again, that's what will get the biggest bang for our buck.
Awesome. So I want to follow up with one additional question there, Dr. Delden. And we at the Michigan Fitness Club Association surveyed a number of mental health providers in Michigan in 2022. And overwhelmingly, they all said that they believe that exercise and physical activity should be a part of their patients' treatment regime. But also overwhelmingly, they said, we don't do it because we're not comfortable with it right now, which I completely understand. What would you say to those professionals that are in that position where I believe it, I think it should be done, I'm not comfortable with it, I don't feel it's in my scope of practice per se? What would you say?
To learn about it, because again, it has such an important impact. I mean, if you don't feel uncomfortable recommend medication, why would you be uncomfortable recommending exercise, which has fewer side effects? So to me, it's like, it's up to them to do. So I 100%, I'm like a zealot about evidence-based care. We should only be doing things that we know work, period. Exercise works. So if you're not doing it, you're not giving your patients or your members or clients the best care possible. They need to know. It's up to you to educate them and yourself around this issue.
Awesome. And then this is a part of that education. And, I'll also say there are, tremendous community partners who implement, these evidence-based practices in the community. There are exercise professionals, parks and rec professionals in your communities, who are degreed, they have the proper credentialing. And ultimately, just as this webinar and the Michigan Moves Coalition is very much a multidisciplinary team or group of people, as they often say, it takes a village. There are the ability to partner with the right resources in your community.
Right, exactly. And again, looking to experts like you might as a therapist to a psychiatrist for medication, look to Dr. Hassan on how to do exercise and learn about it.
Absolutely. And the resources, they're there. As you said, the evidence base is there. It's not like it doesn't exist. So now it's just a matter of becoming comfortable with it. Ashley, from your perspective as a public health professional, I'm going to broaden this to not just, the public health professionals that are listening to this, but also, as a representative from MDHHS, just for concerned citizens in Michigan that are listening to this, how would you want people to think about, physical activity and mental health?
Yeah, so the first, and we touched on this briefly earlier, but is the amount. So even small amounts of physical activity have substantial benefits to our physical and mental well-being. And I think we've been stuck in the field for a very long time of being so prescriptive about it. We were talking about physical activity guidelines, and while those are important, I think we also need to remember that at times we can alienate people with those guidelines, right? Like it can feel overwhelming or honestly, in some people's day-to-day and their abilities, like not even possible. So I feel like sometimes we get this like mental shift of thinking, if I can't do the 150, why bother at all? And so I would really love to see, like, just in general, in public health, of course, but even outside of it, shifting away from being like, any physical activity is great physical activity, and keeping in mind that it doesn't have to be what we've always thought it was, of going for, training for marathons or, like swimming laps in a pool. Like it can be as simple as like meeting friends to play pickleball at your local park. It might be group fitness for some, and for others it might be riding their bikes to like pick up their kids from their school or walking to work. And so really thinking about physical activity in a much broader sense. And I think from there, not only will we see substantial benefits and more impact, but we'll see people also taking on more sustainable ways that they can continue to be physical activity through their daily lives. And another thing, and this is more of like an action, it's probably more for the field of public health, but to really think about, and this fits into the way that we've been, quote unquote, like prescribing physical activity, in this field for a while, is thinking about the way that we build and design our environments in our communities. Because as much as that seems like something that's maybe out of like even healthcare's realm or public health's realm, it is so important to the way that we are physically active and to the way that we move about our communities. So really starting to think in the sense of like, how do we access our parks, our nature, our sidewalks, our bike lanes, things like that. So thinking about physical activity much more than the activity itself, and starting to think about it as the way that we build our communities and our environments. And I think by taking those two shifts, we really can start to build communities throughout Michigan and throughout our nation that just allow people to naturally just move throughout their day. And I think we'll have a host of benefits in terms of connectivity with our neighbors and our communities, but also our physical and mental health in that space.
You said it's making physical activity the easy choice. Basically, the last 50 to 75 years, we've figured out a way to make physical activity the hard, if not seemingly impossible choice in a lot of circumstances. And, by engineering communities, and, Rebecca, I know you are very involved in some health equity work. I think, Ashley, you would probably agree that the communities that need this the most are the communities that tend to be, lower socioeconomic status, that don't have these green spaces. Or for that matter, the gyms and the fitness industry infrastructure that could be there for people to engage with. So I think, we need to think about this in the underserved communities as much as anything else. I think, here in the Ann Arbor area, I think all of us that are in this area are very well aware of the difference between, communities in Ypsilanti, communities in Ann Arbor, and we're all very well aware of kind of the famous statistic on the 10-year difference in life expectancy on the side of, US 23, depending on where your zip code is. And so engineering the community the right way, and I think everyone who's on this webinar right now, even if you're not in public health, or if you're not in, community planning, if you're a member of a community, you can go to zoning meetings, you could speak to your local politicians about the importance of ensuring that, physical activity and green space is engineered into your environment. And if you are willing to speak up, people will listen.
I also think to add to that too is thinking about advocating for the spaces you have, because a lot of the times there's this assumption of, okay, so this green space or this park exists, but is that a safe place or space? Is it walkable? Is it well lit? And so there's so many other things to consider when we're thinking about spaces that we can access for physical activity. And so that would also be, my charge for people as well, is to say, if you feel like there's a space in your community that needs to be bettered in order to make physical activity more accessible, then, speak up and get your communities involved. And I think there's a lot of power in that.
And your voice can make a difference. I think that this is a time where people are very willing to listen to the importance of health and well-being, and particularly when you can connect it with this mental health component. I've never once had a conversation with somebody about moving outdoors to improve mental health, and they've said, that just doesn't make sense to me. Like, this intuitively makes sense to everyone. It's just we need a loud enough kind of groundswell of support to actually start to move the needle on this. And I think that the timing is perfect. Rebecca, from your perspective, again, you kind of work in the the academic world, but very much with physical educators and educators in schools. What would you tell those people that are listening as action items from your perspective?
I think from a messaging perspective, it is definitely about the acute benefits of physical activity and exercise, rather than always thinking about those chronic adaptations that come. If I exercise for 2 or 3 months, then I may see these changes. That there are so many benefits, and depending on the outcome that you're talking about, that are the effect of the last bout of exercise you just did. Or when you're thinking about mental health, how you feel while you're exercising and immediately after. Those benefits last, the residual effects of those sessions of exercise last for 12 to 24 hours. So that's why we always make that analogy to medicine. It's like taking your exercise pill, and then the benefits last for 24 hours, and then you need to take your exercise pill again so that you can then accumulate these short-term benefits over time. And I think that's what I have heard from the teachers that they are really excited about, and even parents are really excited about, is that they see immediate effects of physical activity on emotion, mood, energy levels of the students in their classroom. And I think that's really important for people to recognize, is that there's so much that happens with, if we just go for a walk right now, you will feel better in 15 minutes or in 30 minutes or however that boost is. And there's physiological pathways by which we know that that is true. It activates different regions of the brain that help you with focus, attention, mood. So the evidence is there. I think the messaging, it needs to shift in order for that to happen. I know also, as we're talking about resources, what are some of our actions? We can have a lot of resources and they're great, but to your question earlier about what if I don't feel comfortable with the resources and how to use them, we also need to have individuals that help to facilitate that process. Have more training opportunities, more technical assistance opportunities, because it's the same thing with our teachers. They want to implement physical activity, but sometimes they don't feel that they have the permission to do so. Sometimes they don't feel like they have the self-efficacy or their confidence in their ability to do so without their classroom turning into kindergarten cop and kids running all over the place. And so that's what we have really done, is to support teachers across the state by providing resources and working with regional school health coordinators so that they have somebody that's external to the building to come in and walk them along and help them prepare the school for implementation of physical activity, realize what do they need. I know there's questions about mandates and policies. We can put in mandates, but if you don't have the supports that match those mandates, then you're going to create inequities, because there are going to be schools that don't have the resources to meet the mandates that are placed on them. And so we take a different approach about creating support systems, multi-tiered systems of support for physical activity, that helps to improve the confidence of the teachers, helps to provide these structures in schools and in homes so that parents and teachers feel confident in their ability to support their children's physical activity behaviors. And I think that because this is a locally controlled state, that's the roles that we as organizations, we can play to really come alongside our schools, understand what are their needs, how can we use physical activity to meet those needs, and what kind of supports can we give them so they can be successful in achieving the goals for their students' outcomes, whether it's in the home or whether it's in the school.
You said something about messaging that I think is such an important thing for us to all consider. For so many years, and the fitness industry has been more guilty, I think, than anyone of this. We've talked in terms of, very distal outcomes, like, losing 20 pounds, or in healthcare, preventing heart attacks or preventing strokes. All of that, those are all great goals. No one's saying that it's a bad goal, but that the human brain is not wired to be motivated to do something that's 20 years down the line. And I think starting to shift our messaging towards exactly what you said, Rebecca, which is, if you go for a walk right now, like, you will feel better right now. It's not a benefit that you're going to derive 20 years from now. And I think the way we message this is such an important thing at all ages and stages of life. So I think the messaging piece is so critically important.
Mm-hmm.
So we have about 10 minutes remaining that we can open it up to questions. I know I couldn't ask many questions of our panelists, so I can set my intrigue aside if the audience has any questions they would like to ask. While we're allowing people to, think of some time to ask some questions, I always like, and Rebecca, you said it earlier, you like to be the poly-positive on this, right? And so I'll just throw this out to the panel as we're seeing if anybody has any questions. What is it right now that's happening in the space that we're talking about? We'll call it the physical activity, mental health space, whatever you want to consider it, that excites you? Because there's enough that's out there in the media that makes you feel downtrodden and not so excited. Is there anything that excites any of you right now in particular that you're seeing or you're reading about beyond kind of what we've touched on today?
I mean, I think the increased awareness of parents, teachers, superintendents, principals, adults across the state of Michigan, legislators, they're talking about physical activity. They're talking about movement. Those of us who have been in this field for a long time, a lot of us are like, yeah, we need to do more physical activity. Okay, physical activity is good. But again, we were able to see, what does it look like when we are not moving for a good 6 months to a year? And we're seeing some of these unintended consequences from this global trauma that we have engaged in or have been subjected to. And so I think that what I'm most excited to is that, especially during the pandemic, there were so many people coming together with no funding. We had no money, but coming together freely, coming together as a community to put forth their expertise, their resources to help kids move, to get kids moving. Let's move Michigan.
Mm-hmm.
And that momentum has maintained. I mean, so PlayWorks even has an initiative, a coalition, and they are working with legislators to try to pass a bill to incentivize recess. So that schools have additional resources for recess. So, and then we cannot, hopefully putting forth policies that we cannot take away recess for punishment reasons. There's a lot of positive movement around physical activity breaks. We work with Michigan Elementary Middle School Principals Association, and principals are very excited about bringing impact to their schools, about creating more homeschool connections. So there's just a lot, your whole coalition that, Mike, that you're leading the charge in, that we just have this groundswell of movement to where I honestly believe one of the visions our state can achieve in the next 10 years is that we can give every child the opportunity to engage in 60 minutes, accumulate 60 minutes of health enhancing physical activity. And we have the opportunity for our adult population to provide 30 minutes of physical activity, health enhancing physical activity for every single individual. And I think that's an achievable goal that we can reach if we continue to work together and if we continue to pool our resources and facilitate this change across the state.
Yeah, you said there is it's the old Winston Churchill quote, don't waste a good crisis. You know, we came out of this period of crisis, and I feel like, you know, we are all, you know, coming together at this point.
Obstacles or opportunities for innovation.
Well said. Dr. Delden, Ashley, anything in particular that you want to key in on? I mean, we've talked about a lot, and you know, I'm sure hopefully everyone has worked up such a sweat on their walk when they're listening to us that they have to go take a shower and may have to drop off. But anything else that either of you wanted to add before I round it out with a couple of thoughts?
Well, again, I think that what excites me is the same thing from the mental health side. Everyone is talking about mental health. It's one of the top 5 health conditions, finally. There's so much stigma and lack of funding in this as well. So it's good fortune, just like these 2 months, like Movement Month and Mental Health Months are together. Maybe now the fact that both of these are in prime conversation time, that maybe we can put them together, as well as increasing just the ideas on their own.
Yes, absolutely. And Michael, you in the questions made a great comment. He said, you know, message is important as agreed. Long-term body-based or health-based goals will not build long-term exercise habits, as well as short-term intermediate goals. Talks about intrinsic versus extrinsic goals. Yeah, it's very interesting, because, you know, we've seen how we've positioned exercise and physical activity for so long, and we've seen that what it's resulted in is less than 25% of Americans meeting our exercise guidelines for aerobic exercise and muscle strengthening. And if the definition of insanity is doing the same thing over and over again and expecting different result, that's kind of what we've done as a community. So now it is time to shift this messaging. And, you know, to the points that everyone's made here, I think the most exciting opportunity we have is now we are all speaking with one voice as a physical activity community here in the state of Michigan. I'm fortunate enough to represent the Michigan Fitness Club Association on the board of the Physical Activity Alliance, and I'll link up to the Physical Activity Alliance when I send the email out afterwards, so you can see what PAA is doing. But PAA is a national organization that is the physical activity stakeholder groups on a national level. And what you find, and ladies, I'm sure when you've done any work on a national level, you realize that's great and it's impactful, but it's this very macro level, policy level work that seems like it's just going to take years to effectuate any change. The benefit we have here in Michigan, and a lot of the conversation I've had with the PA, is how do we take that national level physical activity policy and implement it here at the state level? And at this point, we are the only of the 50 states, to at least the PA's knowledge and my knowledge, that is looking to actively put together this coalition of physical activity stakeholder groups. So what I would say to all of you is, you know, stay engaged, stay informed. mimovesmonth.com is the website for this initiative. This is only year 2, and I've learned that I need to start planning year 3 as soon as year 2 ends. So we're going to be engaging in the planning process over the summer. You know, Patricia, Rebecca, Ashley, would love to engage you in that. Would love to engage anyone in our audience with this. The time is now for us to be able to take advantage of this as a physical activity community, and there arguably is no more important time to do it. So I thank everyone for joining us on your lunch break today. Dr. Delden, Dr. Hassan, Ashley, thank you so much for joining us with all of your insight. Rebecca, or anyone, if they have any thing that they would like to send out afterwards, if you just shoot me an email, I'll make sure that gets kicked out on an email to all of our attendees. But thank you so much for joining us. And if you haven't already done it today, get out and take a walk in the beautiful weather. Thank you, everyone.
Thank you for having us.
Thank you.